Here is where you will see the power of ultrasound, especially with the wave FE. This is the next wave of facial aesthetics. We are using a top-down approach for filling temple volume deficiency, the peanut head. This is the AAFE technique, top-down approach. How do we know we're in the right plane? Well, that's where we're going to come in and use an ultrasound. In ultrasound, we anatomy mapped this patient beforehand, so we knew what the anatomy of the temple looked like. It's like having an x-ray of the soft tissue. It's amazing, and the Wave FE is an amazingly powerful, small, handheld, cordless ultrasound imaging, and you can see. How do I know that I'm not anywhere near the superficial temporal artery? I don't, unless I really get an ultrasound in there. I can feel in there and get an idea what plane I'm in, but I want to be underneath that superficial temporal artery, and the top-down approach here is one of the safest approaches. Gets even safer when you go ahead and use an ultrasound like the Wave FE here that's made specifically for facial aesthetics. And now we're placing it on the patient here, and let's go to the ultrasound. You'll be able to see the images that it has. It's very simple to use. There's one button. That's how simple it is to use, and it's the most affordable ultrasound and the only one made and optimized for facial aesthetics specifically and for facial anatomy here. So you'll be able to go ahead and see what we're going to look at. Now we'll be able to see all the different layers. You see those little round holes pop up? Those are sections of the superficial temporal artery, and we'll keep pointing out where that cannula is coming in so you can go ahead and see it, and we can light it up with a color Doppler. This simple ultrasound unit is fantastic. See where the cannula is? It's right underneath it, and this is before I go ahead and inject. I just want to make sure my cannula is in the right plane, and this is going to give me the safest injection possible, and that's exactly where it should be for the best results, and especially the top. You've got to learn this top-down approach by the AFE. It's an exclusive AFE protocol. It's amazing. And here's the after, the before and after. You can see on top, peanut head, below, that is filled out quite nicely. We don't want to make it convex because we want to give it a natural shape. And here we can really point it out and you can see it for itself. Ultrasound is the new wave, and it is like having x-ray vision of the soft tissue. You've got to get it. The Wave FE is the best, most affordable ultrasound unit optimized for facial aesthetics and facial anatomy. So make sure you start using this in your practice today. It's really affordable. It gives you the best in safety, not just in the temple area, anywhere else that you possibly can go on the face, and can make you a better injector. And for complications, you can't live without an ultrasound like the Wave FE. So make sure you get one today, and make sure you get AFE certification trained today.